Good evening, students. अभी कोई है नहीं शायद, है ना? कर दूं चालू? Good evening, everyone. Today we are going to study some of these slides. Today we are going to study some of the slides of dental histology, and I've got some ground sections for you. Right? In the previous class, I had got some decalcified sections, and today we will see some ground sections. Right? So questions based on these ground sections. So this is a ground section of a tooth, and can you identify these structures that are seen at the DEJ? Can you identify these uh, features of enamel that are seen at the DEJ? Now take a look at their shape, isn't it? Take a look at their shape. They almost appear like a comma shape, isn't it? They almost appear like a comma shape, isn't it? They do not appear branching. They don't appear to be branching like the tufts of the grass. So you cannot call them enamel tufts, because enamel tufts, they will show distinct branching, right? The enamel tufts will show distinct branching like this, but these are showing more or less of a comma like structure, and hence these are nothing but the enamel spindles, right? These are enamel spindles. And what are enamel spindles? These are the extensions of odontoblastic processes into the enamel. So basically these represent extension of odontoblastic process into the enamel. And if I ask you, is there any component of enamel which is not of ectodermal origin, rather of the mesenchymal origin, then it is this enamel spindle. So these enamel spindles are of mesenchymal origin as opposed to the ectodermal origin of rest of the features or rest of the structures of the enamel. So can you tell me any other feature, any other peculiar feature that you have noticed in this diagram? Why don't we interact a bit, isn't it? uh, Tell me if you notice any other feature apart from the question that I have asked, right? So do you notice something here? Do you notice something here? And do you notice something here? Though it is not completely visible in this particular diagram, we might uh, get to see it in some other diagram. But do you have any idea what this line that differentiates a lighter tissue and a darker tissue represent, or what does this line represent? So let's say this is 1 and this is 2, right? So the feature 1, so the feature 1 is nothing but the enamel lamellae, isn't it? And the feature 2 is the neonatal line. Can you tell me the different types of lamellae that are seen in the enamel? Just tell me the different types, name of the different types if you know them. Don't need to explain anything, just how many are there, maybe 1, 2, 3 or whatever, right? So how many types of lamellae are there? There are 3 types of lamellae: type A, type B and type C. And this is divided based on the content of those lamellae, isn't it? So type A has unmineralized rod or demineralized rod. Type B has degenerated cell, and type C has debris, right? It is a crack. It is not a true lamellae. And the second feature that you notice here, which differentiate or which separates a lighter tissue from a darker tissue, is nothing but the neonatal line. So neonatal line is an accentuation of striae of Retzius, isn't it? It is an accentuation of striae of Retzius, and it differentiates the It differentiates the prenatal enamel from the postnatal enamel, right? So this was the first diagram for you. Let's go to the next histologic slide. So again we have a ground section. So as I told you, today I have got all the ground sections for you. So in this diagram, I hope you can easily appreciate certain incremental lines. So can you appreciate certain incremental lines here? Now remember that the cross striations, that the daily incremental lines, they are not seen in the light microscope, right? They are only seen in the electron microscope. But apart from that, stria of Retzius, neonatal line, all those things can be easily visualized in the light microscope, right? And apart from the incremental lines, we also have a feature that we were talking about in the first slide, right? हमने वहां बात की enamel spindles, but we said that these are not enamel tufts, right? But here, can you visualize the tufts? Can you see certain structures here that show branching, right? Can you see these structures which show branching, right? Can you see these structures which are showing branching? So these branching crack-like appearing features, these are nothing but the enamel tufts, right? These are nothing but the enamel tufts. So you can appreciate the branching in this, isn't it? You can easily appreciate the branching that is happening here. So these are the enamel tufts. And can you appreciate the stria of Retzius in this diagram? Can you appreciate stria of Retzius in this diagram? As you can see, this is the neonatal line, right? This is the neonatal line, and the lines parallel to these neonatal lines, they are the stria of Retzius. They are the stria of Retzius. And again, you can appreciate the enamel lamellae here, right? What else can you appreciate here? Can you appreciate the DEJ? Can you appreciate the DEJ here? See, this is the dentino-enamel junction, right? So again, this is a decalcified section showing the dentine and enamel. Now this is a slide which represents a pathologic condition. Can any one of you identify what it is showing? I will help you with it, right? Let me tell you that this is dentine, right? And this dark appearing tissue is enamel. So if I have told you this much, that we have dentine and we have enamel, can you identify the pathologic feature that is shown in this diagram? Can you appreciate that the enamel is not just restricted to its normal location, but it seems to be lining the dentine. It seems to be lining the dentine, right? It seems to be lining the dentine. It seems to be invaginating inwards. It seems to be invaginating inwards towards the dentine. So can you identify the pathological condition that is shown in this diagram? Can you identify the pathological condition that is shown in this histological diagram, in this ground section? The enamel seems to be invaginating inside the dentine, isn't it? So do you think this tissue represents dens indente? Do you think this tissue represents dens indente? Right? So what is this ground section representing? This ground section is representing a case of dens indente, where the enamel has invaginated into the dentine. Clear? Now next I have a ground section. Nahi Bhavna, it is not caries. This is enamel invaginating into the dentine, right? The enamel is invaginating towards the dentine. And enamel, when it moves towards the dentine, you will first identify it as dens indente. There might be caries here. There might be caries here, but that was not my question, isn't it? My question was, what does this pathological condition represent in terms of the invagination of enamel into the dentine, isn't it? So let's go to this next diagram. In this next diagram, what we have is a ground section of the root portion of the tooth, right? This is the root portion of the tooth, and let me magnify it so you can easily visualize it, right? So what do you see here? Here we see the dentinal tubules, right? These are the dentinal tubules. The dentinal tubules were going uninterrupted, and then we suddenly have an interruption here. Can you identify the feature that I have encircled? Can you identify the feature that I have encircled? This is the section of a root. This is the ground section of a root. And can you see a globular structure in the middle of this root? Can you identify what it is? Can you identify this feature? So what is this? This is, how does it appear? Do you think it appears something like this? It has a lamellated arrangement. It has a lamellated or a layer by layer arrangement. So which feature or which structure in the pulp or in the root has this lamellated or this layer by layer arrangement? Do you think it is a pulp stone? Do you think it is a pulp stone? Do you think it is a pulp stone? And if it is a pulp stone, which type of pulp stone is it? Is it false or true pulp stone? Is it false or is it a true pulp stone? And is it an attached, is it an embedded, or is it a free pulp stone? What type of pulp stone is it? How do you classify it? This pulp stone, since it is found entirely embedded within the dentine, this is embedded false pulp stone, isn't it? This is the embedded false pulp stone. Now, an embedded stone, a free pulp stone, or an attached pulp stone, these are just the different stages in the life cycle of a pulp stone, isn't it? So any pulp stone, it is first formed freely in the pulp, isn't it? But as the secondary dentine keeps on forming, they will first become attached, and later on they will become embedded, isn't it? So the pulp stone is initially free, then it becomes attached, and then it becomes embedded. So here what we saw in this histological section is an embedded false pulp stone, right? Now what do you see in this section? What pathology has occurred in this section? And then next, what has happened? Do you see some sort of repair in this tissue? Do you see some sort of repair in this tissue? And if you do, then what type of repair does this tissue represent? What type of repair does this tissue represent? What type of repair does this tissue represent? The tissue that I have outlined, what is it? Is it dentine? Is it cementum? Is it enamel? What is it? Can you identify this tissue? Is it enamel? Is it cementum? Or is it dentine? Can you identify this tissue? So what is this tissue? As you can see, it has so many cells in it. It has so many cells in it, isn't it? It has so many cells in it. All these black dots, what do they represent? They represent cells, isn't it? So basically this is the cellular cementum. This is the cellular cementum, and what it represents is the anatomic repair. What it represents is the anatomic repair. So you can appreciate that the outline of the root is restored in this diagram, isn't it? So there has the anatomic repair has taken place in this tissue, right? And can we easily identify the cellular intrinsic fiber cementum in case of anatomic repairs? So in case of anatomic repair, this is the only location where you can easily pinpoint that this entire cementum is cellular intrinsic fiber cementum. isn't it? So only in the case of anatomic repairs you can easily identify that this tissue is entirely cellular intrinsic fiber cementum. Otherwise, cellular intrinsic and cellular mixed fiber cementum, they always overlap, isn't it? They always overlap. So this is the next tissue. Again, we have a section. This is a cross section. Now remember that this is a cross section. Some of you might be thinking why the stria of Redius is not oblique to the enamel rods. The reason is because this is a cross section and not a longitudinal section, right? That's why the stria of Redius and the neonatal line, they all appear circumferentially arranged, isn't it? They all appear circularly arranged, isn't it? Again, we can see the neonatal line and the stria of Redius. There are enamel lamellae visible here, and there are lots of enamel tufts visible in this section, right? So what do you see in this section? 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 So basically, this is the section of a cusp tip. This is the section of a cusp tip. And what specific feature can be noticed here in the cusp tip, right? What specific feature can be noticed here in the cusp tip? So in the cusp tip, take a closer look and you'd be able to see that the enamel rods here are quite wavy, isn't it? The enamel rods here are quite wavy, isn't it? The enamel rods here are quite wavy and they are crisscrossing each other. So what is the term used for such an arrangement of the enamel rods? These are known as gnarled enamel. Now can some of you tell me, can anyone of you tell me what is the importance of gnarled enamel, or what is the significance of gnarled enamel? How does this gnarled enamel help? How does this gnarled enamel help? This gnarled enamel, what it does is it increases fracture resistance, or it increases crack resistance, right? So it imparts mechanical properties. So can you tell me a disadvantage of this gnarled enamel? Can you tell me a disadvantage? Let's talk in terms of clinical significance, right? Let's talk in terms of clinical significance. So let's say in terms of clinical significance, right? Let's say, what would Nitin sir say? What would your endodontic faculty say? Gnarled enamel, is it, does it make their job easy or does it make their job hard? It's difficult to get polished or smooth walls of a cavity preparation in these areas, right? So for Nitin sir, these gnarled enamels, they make his life difficult. Why? Because the enamel rods, they are moving in every direction, and because of that, the endodontist is unable to get a smooth surface of the prepared cavity, isn't it? What do you see here? What do you see here? So there are so many curvaceous structures visible in this tissue, isn't it? Can you first identify the tissue? Can you first identify the tissue? Can you first identify the tissue? What is this tissue? What is this tissue? Is it enamel? Is it dentine? Is it cementum? What is it? First identify the tissue. Option A, enamel. Option B, cementum. And option C, dentine. So which of these three do you think this tissue, this slide is showing? Whether is it enamel, or is it cementum, or is it dentine? What do you think it is? What do you think it is? Is it option A, enamel, option B, cementum, or option C, dentine? What do you think this tissue is? So this tissue, as you can notice, it has these lines, isn't it? And what do these lines represent? they represent dentinal tubules, not cementum, है ना? These lines represent dentinal tubules, and the dentinal tubules are found in dentine, isn't it? The dentinal tubules are found in dentine. So take a stock of these lines. There's so many lines, isn't it? So what does this represent? It represents dentinal tubules. So this tissue is dentine. Now can you identify these structures, these curvy structures? What are these curvy structures? So dentinal, so we have identified it as dentine, isn't it? And this is a ground section. So this is a mineralized section, and we can appreciate defects within this mineral content, right? So what are these defects? What are these defects called? And can you see the shape of these defects? How do these defects appear? These defects appear somewhat like this. These defects appear somewhat like these curves, isn't it? These defects appear somewhat like this, isn't it? So what do you think these defects represent? What do you think these defects represent? These defects represent interglobular dentine. Very good. Interglobular dentine. So interglobular dentine, can it be classified as a hypomineralized area or a hypermineralized area? Is it hypo or hyper mineralized area? How would you classify this interglobular dentine, and where is it commonly found? Is it commonly found in circumpulpal dentine, or is it commonly found in secondary dentine? Where is it commonly found? Where is it commonly found, and what type of dentine is it? Is it hypomineralized or is it hypermineralized? So think of the answer and let me know what your answer is. So let's go to the next diagram. So by the time you answer my question, let me show you this next histologic slide, right? So this next histologic slide, we initially previously we had two slides where I showed you the cross section of the uh, enamel and dentine, isn't it? That was the cross section, and you could see the circular striae of ridges which were arranged concentrically. But this is a longitudinal section. This is a longitudinal section, and here you can appreciate those same neonatal line, the striae of ridges, moving obliquely to the direction of the enamel rods. So just to give you an idea of how they would appear in the longitudinal section and how they would appear in the cross section, we have got these two different histological slides, right? So let's go to the next image. So this is the image of a ground section of root. What do you notice in this region? How do you classify this area of the tissue? So what is the specific feature visible in this portion of the tissue? So what is the specific feature visible in this portion of the tissue? Now when you compare the tissue on the adjacent sides to the tissue that is seen in this area, what you would notice is that the dentinal tubules, the outline of the dentinal tubules is clearly visible here, isn't it? The dentinal tubules are clearly visible here. Even they are visible here, isn't it? But the outline of dentinal tubules is not seen here. Plus the tissue appears glassy, isn't it? The tissue appears translucent, the tissue appears transparent, in fact, isn't it? So do you think this tissue, this dentine, is the glass like dentine, it is the translucent dentine, it is the sclerotic dentine? Do you think this portion is sclerotic dentine, isn't it? So when you take a look at the sclerotic dentine and compare it to the adjacent, you would realize that in the sclerotic dentine, the typical outline of the dentinal tubules is lost and the tissue appears translucent, isn't it? Now, as far as the interglobular dentine is concerned, beta, it is a defect, isn't it? The globules are the sites of mineralization, isn't it? We have read that in the class. These are the sites of mineralization. And if the mineral globules, these spheroids of globule, if they fail to fuse, then the intervening area, will it be hypomineralized or hypermineralized? Will it be more mineralized or will it be less mineralized? Obviously, it did not get mineralized, isn't it? It did not get mineralized. So, this is hypomineralized. And another thing, that mental dentine formation is highly regulated. The heterogeneous nucleation does not take place in mental dentine. मेंटल डेंटिन में हेट्रोजीनियस मिनरलाइजेशन नहीं होता है, वहां पर विजाइकुलर मिनरलाइजेशन होता है. द ओडोंटोब्लास्ट सीक्रेट्स द मैट्रिक्स विजाइकल which contains all the components for nucleation, and this is directly deposited in the mental dentine. So circumpulpal dentine, interglobular dentine is not seen in mental dentine, right? Interglobular dentine is not seen in mental dentine. Where is it commonly seen? It is commonly seen in circumpulpal dentine, right? So it is commonly seen in circumpulpal dentine and it is hypomineralized. It is unmineralized in fact. So interglobular dentine is unmineralized and it is commonly seen in circumpulpal dentine, but it can be seen in both secondary and tertiary dentines as well. So let's go to the next question. So I have shown you the sclerotic dentine. Now this dark tissue, what does it represent? This dark tissue, what does it represent? It represents the dead tract, right? It represents the dead tract. Now this I have told you that this represents the dead tract. Can you now tell me what type of light source has been used to view this slide? Is it the incident light, that is it the reflected light, or is it the transmitted light? Under what type of light are you looking at this diagram? ये जो हमने हिस्टोलॉजिक स्लाइड देख रहे हैं माइक्रोस्कोप में, what type of light has been used? Is it transmitted light or is it reflected light? So what source of light has been used to view this slide? I have already told you that these are the dead tracts. So dead tracts are appearing dark. Now can you tell me from this information, can you tell me the type of light source that has been used for this tissue, to view this tissue? Can you tell me the light source? See, the dead tracts, they behave like opaque tissue, isn't it? So if you are watching from this side, let's say, and the light is reflected, then you will see the light coming towards you, isn't it? So then it will appear light. But if you are using transmitted light, then again it will get reflected and the light will never reach you, and this will appear dark and the dead tracks will appear dark. So what source of light is being used? Transmitted light. That is, the light source is away from you, isn't it? The light source is away from us. It is not on our same side, it is away from us. Clear? Can you also notice a tissue here? Can you notice this tissue? It's lighter tissue, right? So make the outline of the tissue. Can you notice this tissue? And also can you notice that the dentinal tubules, they have a different direction as compared to what is seen in this region, isn't it? They have a sort of a different direction than what it is seen in the rest of the thicker tissue. So can you tell me what tissue is this? Can you tell me what tissue is this? Is it secondary dentine? or is it tertiary dentine? How do you classify this tissue? Is it secondary dentine or is it tertiary dentine? What would you say about this tissue? Now, had it been limited to just a small area, had it been limited to just a small area, I might have said that this is tertiary dentine. But since it is lining the entire pulpal wall, since it is lining the entire pulpal wall, do you think this is tertiary dentine? Am I audible now, Bhavna? Since this is lining the entire pulpal wall, do you think this is the tertiary dentine or do you think this is the secondary dentine? What type of dentine are you seeing in this picture? Is it secondary dentine or is it tertiary dentine? Am I audible now? Bhavna, am I clearly audible now? Yes, very good. It is secondary dentine. It is secondary dentine, right? Since it is lining the entire, so based on the location plus with the help of the dentinal tubules, we were able to identify it as the secondary dentine, isn't it? So let's go to the next diagram. So in the next diagram, I have enamel, lamellae, isn't it? And some very good enamel tufts. Right, these are all branching, but we have already seen similar diagrams. So let's move forward. So what feature do you notice in this diagram? So I have encircled certain features that are visible in this tissue, right? I have encircled certain features that are visible in this tissue, and I'll zoom in so that you can see them clearly. So I have encircled certain features in this diagram. Can you identify what are you looking at? Can you identify what are you looking at? So first of all, please identify the tissue. Is it dentine? Is it enamel? Is it cementum? What is it? Is it dentine? Is it enamel? Is it cementum? What do you think this is? What tissue is it? Is it enamel? Is it dentine? Is it cementum? What tissue is it? And once you identified the tissue, then let me know what feature is visible here. Let me also help you by saying that these are a type of incremental lines. These are a type of incremental lines, though they are not exactly incremental lines. These are type of incremental lines, right? So there are only some incremental lines, isn't it? So Kushi says that this is enamel. Kushi says that this is enamel. So how do you identify this is enamel? How did you identify this is enamel? Beta, as we have already seen, enamel in ground section appears a bit yellowish, isn't it? It never appears exactly white, isn't it? It never appears exactly white. I've shown you so many sections. Not even in a single section has enamel appeared so much white, isn't it? It always appears a bit yellowish in color. So this is the enamel which is appearing a bit darker in color, isn't it? And just beneath the enamel we have dentine, which appears a bit whiter in color, isn't it? Then what I have encircled is sort of a incremental line. It is sort of an incremental line. It is not exactly an incremental line. So which feature in the dentine is described as sort of an incremental line but is not exactly an incremental line? Because had it been an incremental line, it would be continuous throughout the tissue, but we don't see the continuation of these lines in the rest of the tissue. Also, they are continuous in the intervening areas as well, isn't it? We can see 1, 2, 3 and 4 lines here, then there is a lack of these lines here, then again we can see 3, 4 lines here, then again there is a lack of such lines here, then again we can see 2 or 3 lines here, and these are just limited to only this much of area, isn't it? Beneath it again there is a lack of these incremental lines, and here again there are no incremental lines. So what do these lines represent? What do these lines represent? What do these lines represent? These are the contour lines of oven, isn't it? These are the contour lines of oven. So contour lines of oven are not exactly incremental lines. How are they formed? The original definition is that they form when the secondary curvature of dentinal tubules overlap, isn't it? So the dentinal tubules, they have small vibrations throughout their length, isn't it? And when these small vibrations, when these secondary curvatures of the adjacent dentinal tubules overlap, they result in the formation of contour lines of oven. So what you are looking at in this tissue are the contour lines of oven. Can you appreciate them? Can you appreciate these contour lines of oven? This black thing is very commonly seen here. Uh, it is representing the caries attack, and here it is representing the dead tracts, right? So if you are talking about this blackish discoloration here, this is the caries, and if you are talking about the black discoloration here, this is representing the dead tracts, right? But then these are the common findings, so these you should be able to identify any day, right? If black discoloration is seen within the dentine without any defect at the enamel portion, then these are more or less dead tracts, right? Some insult must have happened, some trauma or something else which did not lead to caries, but it did lead to formation of dead tracts. And similarly, if there is a blackish discoloration of the enamel associated with some discoloration in the dentine, here though discoloration in dentine is not seen, so maybe this is just a pet caries limited only to enamel or just enamel surface caries, right? We can't say exactly because we don't have the whole of this picture, right? But we can definitely say that these are the dead tracts, right? Also, you can notice the interglobular dentine here. So they are seen in the circumpulpal dentine and not in the mental dentine, isn't it? So what is the main feature that is seen in this diagram? The unique feature that is seen in this diagram that we haven't seen in any of the histological sections so far, it is the presence of the contour lines of oven. So this is a rare feature, right? This is a rare feature seen rarely. So you should be able to identify it, right? तो identify कैसे करेंगे हम? How will we identify? We will look for their continuation and we will look for their regularity, isn't it? We will look for their continuation and we will look for their regularity. So as you can see, they are starting randomly and they are ending randomly. Abrupt start, abrupt stop. They are starting abruptly, they are stopping abruptly. So suddenly they vanish in this coronal portion and they are also absent in this radicular portion. Also, they are not regular, isn't it? We have 4 lines, then there is a break, then again we have 3-4 lines, then again there is a break. So that is how you identify that these are not any regular incremental lines, rather they are the contour lines of oven. Clear? Because this is a rare feature, you might get confused between contour lines of oven and other features. So that's how you identify them. So this was the last slide. I hope the class was helpful for you. If you have any questions, please feel free to ask. If you have any questions, please feel free to ask. खुशी, भावना, कोई भी सवाल हो पूछ सकते हो. और अगर सवाल नहीं है तो फिर हमारी क्लास हो गई, राइट? So I guess you don't have any questions. So okay then.